Unmute if you would, Kay.
You want me to go ahead and repeat all that?
Yes, please.
Okay, we're figuring out technical. This is my first opportunity to host with AARP. So welcome to today's seminar series. My name is Kay Spearbud, and I'm an AARP volunteer in Anchorage, as well as a veteran. On behalf of AARP Alaska, I'd like to welcome you to the first in our 4-part Veterans Informational webinar series. Today, our guest speaker is Verdie Bowen, Director of the Alaska Office of Veterans Affairs. We are so excited that all of you have joined us today. Before we begin, I would like to share a few technical tips for those who aren't as experienced with Zoom. I myself have found these quite helpful. So your microphone should be on mute. Can we go to the next slide? Patrick, can you?
It's showing as that it advanced for me, but.
Does everyone else have the second slide up? It looks like the bottom of your screen where it shows.
No.
Okay.
Patrick, unshare and share again.
Okay.
Okay, you can keep going on and.
Okay, the next slide that Patrick's going to show us is just a screenshot of the bottom of your screen where you see the mute and the stop video buttons. Your microphone should be on mute. You can tell it is on mute if it's got a red line drawn through it. If it doesn't, just click the microphone to mute it and unclick it when you want to talk. We also learned there's a quick shortcut. If you hit your space bar on your keyboard and hold it down, you can talk. As soon as you lift it up, it'll go back to mute. Keeping yourself on mute will prevent a lot of background noise. Oh, yay. Thank you, Patrick. The next button you'll see in the slide is the video button where you can be on camera or turn your video off. If there is a red line through this button, you are off camera. Please turn off your video today to save on bandwidth. Pardon me. Under the participants button, you will see a list of everyone on this call. You can click on that. It would be helpful for us if you could rename yourself if you aren't logged in with a name. So at the top, you'll see your picture or your screen and with your name there, and you can rename that just by selecting 3 dots to the right of your name. Under chat, we will be asking people to respond in chat. To use chat, click on the button, type in the box, and hit enter when you are done. If you haven't already type in the community you are joining us today. You can also ask questions in chat. And what I've noticed is you can have the participants list and the chat open at the same time and still see the screen. If you click the reactions icon, you will see that you can raise your hand. Use this if you'd like to ask a question verbally. We are recording this program and we'll send out the recording and all the links from the chat after the program. Next slide. AARP is a nonprofit, nonpartisan membership organization for people over age 50. We have 38 million members nationally and 77,000 members in Alaska. AARP's mission is to empower people to choose how they live as they age. To optimize their power, we encourage people to save for retirement, stay healthy and fit, including brain health, build strong relationships, have meaningful activity in their life. AARP Alaska is working on age issues for Alaskans over the age of 50. We do this through advocacy, education, member engagement, and community action. We advocate by working on national issues like Social Security, Medicare, and prescription drugs. At the state level, we are advocating for a sustainable state budget, senior grant programs, and increasing the workforce. We educate by offering classes on brain health, technology use, veteran services, gardening, fraud prevention, caregiving, resources, and financial planning. Member engagement is accomplished by hosting social groups, movies, guest lectures, exercise groups, and many more events. And through community action, we have local teams in Juneau, Ketchikan, Anchorage, and Mat-Su working to make their communities more age-friendly. Next slide. Today, Verdie Bowen, Director of the Alaska Office of Veterans Affairs, will share updates on changes to veteran service-connected disabilities, the difference between veterans benefits and veterans health services, as well as a basic overview of how to apply for services from the VA, including an overview of Verdie's Benefits Navigator. And I'll quickly read through Verdie's bio, which is quite extensive here in Alaska. Mr. Verdie Bowen in 2009 was appointed by then Governor Sarah Palin to his position in the Office of Veterans Affairs. As director, he is responsible for the development and establishment of policies and strategic plans that directly affect all veterans, active duty, reserve components, dependents, and survivors living in the state's 348 communities. The total number of Alaskans affected by these policies and strategic plans are just over 230,000. Mr. Bowen served nationally as the 70th president of the National Association of State Directors of Veterans Affairs. In this position, provided key testimony for 5 major pieces of legislation. The most critical, the VA Modernization Act of 2017 and the VA Mission Act of 2018. Since his appointment, Director Bowen has traveled to all communities in Alaska. He has provided critical testimony to the U.S. Senate on rural health care and helped as a member of the 13th Working Group to facilitate the establishment of a memorandum of agreement between Alaska Tribal Health agencies and the federal VA, allowing veterans to receive health care in villages across Alaska. Mr. Bowen was the past chairman of the Federal Advisory Committee on the Readjustment of Veterans and held a position on the Department of Veterans Affairs Rural Health Advisory Commission. He has also provided guidance and testimony to the Alaska State Legislature on several local veterans issues. As a 23-year veteran of the U.S. Air Force, Mr. Bowen began his military career in 1981. He served in several units as a communications specialist. His military operations include Desert Shield, Desert Storm, Provide Comfort, Deliberate Guard, Deliberate Forge, Dynamic Response, Enduring Freedom, and Noble Eagle. During his service, he supported the research and development of long-range communications pertaining to the Global Positioning System and the Strategic Defense Initiative. He managed the deployment of the Defense Mediterranean Improvement Satellite Program. He installed the first Alaskan Bandwidth Management Network. Mr. Bowen holds a Bachelor of Science in Business Information Systems from Bellevue University, Nebraska. He is married to Catherine Bowen, and they have 4 sons and 4 grandchildren. Please welcome Verdie Bowen.
Okay, I'm gonna have to cut that down some.
A lot of experience there, Verdie.
Yeah, well, we'll get right into this. And you know, it's really interesting because we just finished with the Federal Advisory Committee for rural health. It was in Alaska last week, and I think that we were able to get some key points across to them about some of the issues that we have up here. But what I love is that when you were talking, I wrote this down. You got 77,000 people that AARP represent, and we're at 69,000 veterans, and then all of the the 141,000 dependents. It seems to me like that we're trying to reach out to fairly much the same group. So that's a good point, and I just want to thank you for that introduction, Kay. So let's start with the first slide. this is going to be a PACT Act overview. And the PACT Act is something that was just passed, was signed into law on August 10th of 2022 last year. And it's the Promise to Address Comprehensive Toxics Act of 2022. And you know, Congress loves to come up with beautiful things, but let's go to the next slide. The PACT Act is the best way to observe this and to think about this. You know, Vietnam era veterans or Vietnam veterans waited, you know, almost 35 years before they started talking about the exposures to Agent Orange and some of those combat exposures that was there that was causing issues for our veterans that were returning home. This is fairly fast, and this also covers a lot of those areas that we have missed as we go along as we find out more and more toxins that are out there. The PACT Act expands and extends eligibility to VA healthcare to veterans of toxic exposures and veterans of the Vietnam era, Gulf War, post 9/11, and expands eligibility for benefits for veterans exposed to toxic substances. You know, it's really interesting. Each one of us, as we live through life, you know, we use different chemicals in our homes. The military uses lots of chemicals. And so, and then as we burn them and as we try to dispose of them and things like that, those people generally are the ones that have issues. Next slide, please. This act, the PACT Act, what makes it so unique is it expands the eligibility for VA health care with toxic exposures and veterans from Vietnam, Gulf War, and post 9/11. It covers them all. And as we get towards the end of the slides, I'll go over a few of the other areas that have the toxic exposure issues. VA will improve decision-making process for determined medical conditions will be considered for presumptive status. The key for this is on the PACT Act is the presumptive side. You know, it's very sad that when we find a veteran that was in a tent downwind from a burn site and they have severe asthma, very severe asthma. No one in their family has it. They have never had it before in their life. They even have scarring in their sinuses that was due to some of the chemical exposures that they have. And it makes it very hard for us, if they did not get that documented before they get out, to help that individual receive that health care that they've earned. And so, or actually, better yet, the health care that they need so that their quality of life can improve. The PACT Act, the great thing about this is that it's going to help us have a tool in the VA to add more items to the presumptive list as we go along. Let's go to the next slide. This is the best part about this, is that it is going to ensure that they're going to have more studies on the mortality of veterans who served in Southwest Asia, Gulf War, post 9/11, veterans health trends, veterans cancer rates. And I want to give you an example on veterans cancer rates. One of the cancers that we have seen in my office that was really elevated, and we had never seen this before actually, and it was called glioblastoma. We had 6 veterans with glioblastoma in 1 year between the ages of 18 and 45. That's really sort of unheard of, because if you look across the nation, glioblastoma is really low. You're talking less than 1% of 100,000 people at that age group would receive that. It's normally people that are over the age of 65 would see glioblastoma. It's more like 7 out of every 100,000. And it was something that we brought to the attention of the senator, and we ensured that that was put into the PACT Act. So as you start looking through these studies that are going on right now, we're going to find more and more items added to this act as we go ahead. The other thing that the PACT Act did was that it expanded, it added 31 new medical facilities across the nation that is going to help us care for those veterans that are being served under the PACT Act. I'm not going to go through all the presumptives. You can see that the conditions are fairly much, a lot of them are fairly lethal if you start really looking at them. Asthma, chronic bronchitis, chronic rhinitis, chronic sinusitis, bronchitis, emphysema, and then you high blood pressure. And those items are less lethal than some of these other cancers that are in here that are identified from the exposures to this. What is so important about this is that if you even served within that region or served in Vietnam and you find that you have any of these conditions, you can go to the va.gov/PACT and research those items. If your doctor identifies that item today, you can take that item to me or to one of my service officers, and we can file a claim for that item. And the only evidence that we need is that the doctor has determined that you have that condition. What that has done is it takes a whole lot of work out of the process, having these presumptive ailments. And it also helps us treat our veterans much faster. The moment we determine that they have one of these conditions, they're automatically in the VA healthcare system. We just have to file those paperwork to get them into the system. Let's go to the next slide. The VA healthcare eligibility available now, and you can see that it's all broken down. Vietnam era veterans, it opens that up. Thailand, Laos, Cambodia, Guam, Johnson Atoll. Those are the areas that Agent Orange was at. We finally have got the VA or got the federal government to recognize the fact that the Agent Orange did not stop at the border of Vietnam and actually traveled over into these other countries and affected those veterans, adversely affected those veterans. And so now we're able to open up healthcare to them. And most of the care that they're going to receive is free. And a lot of that has to come back to what is associated with your VA disability. So if your VA disability is for, I'll just, because I was talking about asthma, if it's asthma, the VA will not charge you any copays for that. But if you're at the VA and you're being seen for headaches, they might charge you a copay if your disability is not above the 50% range. Next slide, please. The part about this that I like is that we're talking survivors, because over the last 12 months, my office has filed over 700 dependent indemnity compensations. And what those are is that if the veteran passes away from a disability caused by their military service, if you, let's go back to asthma because that's the one that I use. If you have a veteran that has a documented asthma disability and they pass away from that disability, then the spouse and the children might have benefits as well. The spouse could be eligible for DIC payments, which are right now at $1,400 a month, and be eligible for CHAMP VA if they are not eligible for TRICARE. Also the children would be eligible and the spouse would be eligible for Chapter 35 education benefits. And so you can see that the package starts growing if we determine that the ailment was caused by their exposure to an item under the PACT Act. Let's go to the next slide. When and how should you file a claim? Today is a good day, and there's a reason for that. And I put that up there in bigger letters because I want people to understand that the PACT Act was signed on August 10th of 2022. If we file a claim for you up to August 9th of 2023, and we have that documented in the system, they will back pay you to August 10th of 2022. If you file after 2010, 2023, then your claim will start on that day. And so that has put a rush on us to file even more claims now. As of today, we're 1,200 claims. We have over 1,200 claims that we have filed for PACT Act issues. And it's beyond important to seek our office out or go to one of my service officers. And we have those numbers at the end of this slide briefing. But it is so important for you to reach out to us to file for these things. Any questions, again, you go to the PACT Act, va.gov PACT. The other thing that you want to do is you want to register, and you want to register for medical screening. You want to make sure that you get your medical screening completed so that you're in the system. Now, remember, the medical screening you do at the VA is not a claim. That is just the beginning of the process to keep you in the system. And then 5 years from the time that you file that, they will take and call you back in and have another screening to see if any of the issues, you might have other issues. The medical screening is pretty much simple. I did one, it takes about 3 or 4 minutes. And so it just asks you if you're exposed to chemicals or radiation. And depending on where you were at in the region, you're going to have different exposures to different things. But the whole thing is to make sure that you get into that medical screening. And then when you're completed, then file for your VA disabilities. And if you were previously denied, and that is a real huge thing right now, especially for the DIC payments, as of January, we have been filing a large number of DIC claims, the dependent indemnity claims for spouses for their veteran that passed away due to this over the last year. Now that the PACT Act is signed, just because they passed away from that disability, your family will be eligible for extended benefits. And if you were denied in the past, you need to refile for that benefit. And you can do a supplemental claim, and the VA will review that. And in many cases will automatically provide you with that disability. Next slide. This is, I threw in some slides to let you know that there's other disability items that are out there. Agent Orange has their own list of items. Each one of these chemicals or one of these areas will have different issues that you're going to find. One of the things that we had this last year that was added to the Agent Orange list was Parkinsonianism, which allowed us to help people that have non-essential tremors that served in Vietnam or in that region now receive disability compensation for those. Many people have those issues. A lot of our combat forces on the ground have prostate cancer, and we have been able to help those individuals receive their health care and receive a compensation as each month goes by. Next slide. This is for additional information. This is my contact information. Forrest Powell is on here as well. He's our deputy. And both of us have been running through the state since February, filing claims for people all around the state. We just returned from Ketchikan, and it's important that we reach all of our veterans and get them into this system. Next slide, please. This is another exposure that we have that's out there, and it's one that we deal with almost weekly, which is Camp Lejeune. We had a cleaner at Camp Lejeune dump a bunch of chemicals in the water supply there, and a lot of people that served in Camp Lejeune have got kidney cancer, liver cancers, non-Hodgkin's lymphoma, adult leukemias, multiple myeloma, Parkinson's disease, and it goes on. The biggest one is bladder disease, is the one that we have seen the most, bladder cancer. We've seen quite a bit of that from the Camp Lejeune area. And this to get people to understand that goes from 53 to 87. Next slide, please.
So Verdie, before you move on, I just want to ask about fraud related to Camp Lejeune, filing claims. What do you recommend for people to do and how to file a claim?
When it comes to Camp Lejeune, please see one of our service officers. There's a lot of attorneys out there that are trying to get people to come in so that they can get a portion of that, because that was some of the things that was signed into legislation that allowed those attorneys to do that. Be so careful not to be fraudulent. If someone contacts you, for crying out loud, you will have people contact you. I've even had people send me cards in the mail telling me that I could be completely taken care of if I just called this number. We are free. I am free. You just call me and I will talk to you, and we will get you into the system with one of our service officers, or you'll come see me, or you'll see anybody on my staff, or our deputy, Forrest Powell. But we will walk you through this. Be so very careful of those people that are guaranteeing you money. I just had a family call me yesterday that was, they were reaching out to a place that was going to cost them a couple of $1,000s, that just a couple of minutes over the phone, I was able to help them fill out the paperwork and process it. And it's sad that we have people out there that are doing this fraud. And if you really think, you can either call, you can call AARP because they're well versed on fraud. Some of these people that are out there that are frauding some of our people in the state, whether they're elderly, whether they're elderly veterans, their family members, children of veterans. I just want you to be so very careful. And that's why we have all of these service officers around the state. The only one that I have not got filled right now is we have a brand new Vietnam Veterans of America person that is going to be housed out of Fairbanks. We will have actually 4 service officers in Fairbanks. It'll be the first time we've done that. And that's due because of the increase in veterans that are in that area. And I think, let's see, next slide. This is ionizing radiation. I threw this in here. There's people that were exposed to ionizing radiation. We constantly run into people that were working in the nuclear programs that were in testing, nuclear bomb testing areas, you know, like down in the Pacific and in Nevada. And we help them fill out those documents that help them retrieve funds. If they're no longer living, then we help the families fill out those documents. But also during the Gulf War, they used depleted uranium that when it burned, it put off radiation exposures to those people that were close to that. And that's also a piece of that. And there's some people that worked around ionizing radiation items, like they might have had a nuclear clock in their facility, or they might have had been exposed to X-ray machines and things of that nature. And so we just need to see them, and we're able to help them get into that registry and start working those issues that they have so they can receive that health care and receive the disabilities. Now I'm to the questions. The biggest thing about this is that I can tell you is that many times our veterans we have to work so hard to prepare cases. A disability and compensation cases are just like going to court to defend yourself. You have to build these medical cases with medical evidence, and you have to show that it was accomplished while you were in the service. And then you have to show that there was some sort of documentation in the service of that ailment or that sickness, no matter what it might be. And then sometimes it might not be compensatory, but just getting a document will ensure that the healthcare for that item is covered. And that's a huge part of the VA healthcare plan, if you will. And it is important for us to do those, but it's even easier for us once we have presumptives on an issue or an area, or say, for example, like Camp Lejeune. These are the presumptives for Camp Lejeune. These are the presumptives for you just have to show that you were in that area. Most of the time it's in your personnel records. It might even be on your DD form 214, but we're able to reflect that that person was in that area. And all we need is a current diagnosis, and then we'll process that. They'll evaluate the degree of the disability and provide you from 0 to 100% disability, depending on how severe it is or how not severe that item is. And then that automatically will help you when you register within the VA healthcare system to receive care for that for the rest of your life. Now, there's one other thing that I need to point out is that in the VA system, there's a big confusion here a lot of times that we have with our veterans. They assume one VA is one VA, and that's not the truth. The VA is actually in there are three compartments. There's the healthcare, there's the veterans benefits, and then there's the National Cemetery Administration. And those three areas normally do not talk at the lower level. So if you're receiving healthcare at the VA and your healthcare provider says you should be 100%, that doesn't make it 100%. You have to go back and file in the Veterans Benefits section. And then you have to file a document to release records back to that area so that they know what your doctor had said. And so you have to remember that those places don't automatically talk. And then again, when you file a VA claim, they're not talking directly to your doctor unless you release that area to you. And again, the last people are the National Cemetery, and the National Cemetery is the only group that will reach across and pull your service, not your disability, but they will try and pull your DD form 214 through the VA system over so that you can have, so that you're able to be interred in National Cemetery. And with that, I'm open for any questions. And I see
There's lots going on in chat, Verdie.
okay.
It's mostly about how to get a hold of you. Let's see.
Okay. Well,
Here's one. We have veterans who say they were denied for SC ratings, and they think that means they are also not eligible for health care. Two separate things.
that is correct. Service connected, you could be non-service connected, and I'll pick on hearing because that's probably we have a lot of hearing cases. You can have a non-service connected disability. You did not receive a disability for that, but if you're under the minimum threshold, like your income is under 48,000, you would be eligible for priority group 8 or priority group 7 or priority group 8 within the VA healthcare system and receive all of your healthcare at the VA. You would pay a small copay for your visit and a small copay for your medication. Usually your visits are like $15. Your medication might be $8. And if you have a major surgery, it's $150. So the amount that you would pay for the care would be is minimal compared to what you would pay under Medicare benefits.
So another thing that I always hear, Verdie, from veterans, it's especially older veterans, they say, I don't want to file because I don't want to take services away from somebody else. Can you address that?
You know what is interesting about that is that I do have a list. I'd have to pull it up. It's on my computer, but it's the 10 top reasons veterans do not file for VA healthcare, and that's the number one. And what makes that really silly is that the VA has provided a lot of money at the beginning of every budget cycle to take care of all of the veterans that they assume are going to receive health care within the VA system. If there's funds left at the end of the year, it goes somewhere else. And so you're not saving the VA for anything. And the best example I could use is that we have a VA super community-based outpatient clinic in Anchorage. If all the veterans would have enrolled in the VA healthcare and received their VA disability compensation, that could have been a large hospital. So if you're saving it for someone, you're not saving it for anybody. The VA is going to fund source the items that they need to cover, and whatever's left will be used somewhere else. So if you're not using it, then nobody's using it. That's the best way to put it.
All right. Do we have any other questions?
Hey, Verdie, this is Kay. Quick question for you on the DIC benefit. Is the best thing to tell somebody, the spouse or family, to just come visit your office? And if that's the case, what would they need to bring with you to demonstrate that the veteran died from service-connected disabilities?
Well, the best thing they could do is they need to bring the death certificate, the DD form 214, their marriage certificate. And then if they do have, or if they don't have, we will try and get a hold of it. But if they do have a list of their VA disabilities, and if their VA disabilities match to their to the cause of death, and usually there's 2, 3, sometimes 4 causes of death on a death certificate, it's not uncommon that one of those items are on there. And so it's just, I don't want to say it's automatic. We have to go through the process of filling out the paperwork. But once that cause of death and that VA disability is matched, then that person will see a check for DIC payments, and then the rest of the benefits will come after that. All they have to do is just come to my office or give us a call.
Okay, thank you.
So we have another question: how a veteran or family member can self-navigate some of the PACT Act or other benefits? Or do they need to come in?
The best way to self-navigate is to, give me a second, I'll go back. Go to the va.gov/PACT. you'll find all the information that you want to know about the PACT Act there, and it's in drop-down screens. And you will be able to go through that and find all the information you need. And if you run into a place where you need more information, just give us a call. Now, I will tell you, I registered for the PACT Act online myself, and I'm actually a software engineer, and I'm telling you, that was a difficult task. It took me quite a while. Something that should have taken just a few minutes was hard because I had to go back. They wanted to know the areas I served in. And then I even had to go back up and find out what my task force was called, because I was at different locations that they didn't have there. So, you know, if you find it that sort of arduous, just give us a call and we'll help you work through it.
Is there any kind of wait list?
No, there's no wait list at all on this. All you have to do is you call us, and first come, first serve. And if I have a whole hallway full of people, then I'll stay until we've met with everybody.
Awesome. Any other questions? We have a quiet crowd today.
There's also another thing too. You can call the 1-800 my VA 411, and they will also answer questions for you too as well.
Is that a 24-hour number, Verdie?
I haven't tried it after hours. I've only used it during the day, so I don't know, but I presume it is.
Okay, thank you.
All right.
Okay, if there are no further questions, I'd like to thank you so much, Verdie, to you and your team for your continued service in helping our veterans and families manage all of this. Patrick, would you mind bringing up the next slide for the poll? So we've got a poll we'd like everybody's input on. Thank you again for participating in today's program. We hope you found this session helpful. Please let us know how you like this program by completing the poll on the screen. If you have any ideas for upcoming webinars, please put them in the chat.
The poll says gardening, but it is not gardening, it's veterans stuff. So I'll pull it back up again. Give it a shot. All right, let's go ahead and move on.
Okay. You can find all of our events as shown on the slide at www.aarp.org/AK. If you are interested in registering for any of the upcoming Veterans Informational webinars, go to www.aarp.org/AK and click on the story titled AARP Alaska Announces 4-Part Webinar Series for Veterans in the First 4 weeks of May. That will take you to the webpage that has links to register for any of the upcoming webinars. This webpage is also the place you can view the recordings of the previous webinars in this Veterans Informational Series once they are uploaded. Next slide. Thank you to Verdie Bowen for sharing this important information for veterans with us today. Thank you to all of you for joining us for this webinar series. We will be hosting a webinar series every quarter. We are planning series on financial planning, technology, and a workout series during the winter months. To find out about upcoming events, check out our webpage at www.aarp.org/AK. Thank you.
Great. Join us next week to hear about in-home services that are available for veterans. Thank you.